Hi, and welcome everyone. I'm so excited for another South Coast Veterinary Management Solutions webinar. I'm super thrilled to have Lindsay and Meg visiting with me today. They're going to be talking to us about the importance of resilience in medicine. So I'm super thrilled to hear more about that. As most of you know, my name is Melissa Tompkins Lewis. I am the owner of South Coast Veterinary Management Solutions, which is a veterinary consulting company. I'm located in Southern California, although I do have clients all over the country. And I love helping hospitals and I love helping them grow. And I love doing these webinars because it brings in new cool ideas, new thoughts that we may not get to hear about. So I'm really happy today to have Meg and Lindsay joining us and speaking. So if you're not attending live, this will be uploaded on my YouTube channel, which is at South Coast Manage 263. I always get that number wrong. So if you don't know the number, just look up South Coast Veterinary Management Solutions and you can find it. If you have to leave early, the session will be uploaded probably next week. I'm actually going out of town this weekend for a very much needed girls' weekend. So I'm going to go ahead and let Meg and Lindsay take it away. And so enjoy their speaking or their talk.
Hey, I'm Lindsay Shelton Webb, and I'm from St. Louis, Missouri. I entered the veterinary field at birth, actually. My dad is a veterinarian, and I spent most of my childhood hanging out at the clinic, going on calls with him, staying there when I was sick. He opened his own practice when I was 15, and so at that point, I started working for him as a kennel attendant, and I did that pretty much until I went to college, and then I would come back and forth with college doing various positions there. And after I graduated, I also still worked there part-time while developing my human resource career outside of that. I went to school for human resources and I practiced that in corporate America prior to coming back to my dad's practice as practice manager in 2017. Meg and I met through VHMA in 2019, and she has mentored me into the practice manager that I am today. She helped me decide to start studying for my CVPM, and I completed that in 2023. And that was probably the hardest thing I've done academically, and I'm very proud of that. We also bonded heavily during COVID-19 and were there for each other, supporting each other through the trials that we all encountered during that time. And outside of veterinary medicine, I enjoy traveling all over the world with my husband, Brian, and we enjoy hanging out with our cat, Shade. So resilience is a very important topic in my life. I feel like my parents cultivated resilience within me at a very young age. They gave me a safe space to learn, fail, grow from challenges. These early lessons carried me through difficult times in my mental health struggles, college, career, and just in life in general. This firm foundation of resilience has given me confidence to face adversity and knowing that I can getting through it with minimal impact to my long-term mental health. Seeing everyone struggle within the veterinary industry during COVID made me want to find ways to provide tools to create resilient veterinary professionals. Meg and I both discussed cultivating resilience as being a way of bettering the well-being of the veterinary field and way to improve talent retention.
Hi, I am Meg Oliver, and like Lindsay, I've spent my life in veterinary medicine as well. My mother was the bookkeeper for a local veterinarian who had 4 practices. Just like Lindsay, when you are sick as a kid and you have a parent that works in vet med, you end up at the practice. So under the age of 15, I had little tiny jobs like pulling records for the next day. And once I was 15, I was actually hired by the practice. I have been everything from assistant to receptionist, team leader, inventory manager. I am now the hospital administrator for a 4-doctor practice, and I am in a little tiny town outside of Syracuse, New York. In 2019, I earned my CVPM, and that was definitely one of my proudest achievements. So as a little side note, I met Melissa several years ago, who was actually a bit of a backbone for me and encouraged me to get my CVPM. When I reached out to her, how many years ago, I cannot remember. I had expressed that I was interested at one point in pursuing consulting outside of the practice, and here we are. So I am also serving on the VHMA Ethics Committee. I have worked as a VHMA mentor for several years now. Manager development is definitely one of my biggest passions. That has helped me find the local managers group, which I think might be how I actually met one of the ways I met Melissa. I wanted to form my own local managers group, and that was born out of a desire to prevent other people from feeling the imposter syndrome that I felt when I was a brand new manager. So that was huge to me, and I reached out to her because she had formed her group several years before and had lots of input for me on that. So I am also a writer, and I've published several industry articles to this point. As a side note, I am a mother of 3. My husband Rob and I have 2 3-year-old identical twin boys, Jimmy and Toby, and a 6-year-old daughter named Faye. So as Lindsay mentioned, we met in 2019 through the VHMA, and if I remember correctly, we met while I was helping Lindsay with wellness plans in Avamark. Over the years, we have become good friends, and we really did bond quite well in 2020 while we were experiencing all of the trials during COVID that were just totally unprecedented for the time. So as the difficulties of pandemic practice started to take a massive toll on everybody and individuals in the practice, both Lindsay and I noticed that it was really taking a toll on us individually, despite the fact that we were doing everything that we can, the rapid changes that kept coming our way, the increasing hostile individuals, the short staffed, the short supplies. Even though we were practicing a lot of self-care, we were starting to burn out. We were looking at it from a perspective of why were some people able to handle this challenge with no burnout or minimal burnout, and why were some not? Post-pandemic, what we started to notice is that industry stressors that have always been there, such as difficult clients, difficult cases, those things started to be handled in a way that people were putting much more of an emphasis than they had previously before they experienced the trauma COVID. A difficult client no longer felt like just a difficult client. It wasn't just one of those experiences that happens day to day. It was taking a serious toll on people. Why was something that was completely normal before, not enjoyable, but normal, hitting so hard now? In 2022, both Lindsay and I started playing with the idea of resilience and neuroplasticity. And I can't even remember how we started talking about this, how we came up with these ideas to start looking into these things, but we did, and we started researching on the side, studying, and on our individuals, on ourselves, and into our practices, we started making teeny little changes here and there, and it started to have a really positive impact on both us as managers and our practices as well. So by the time 2024 rolled around, we decided that the changes were substantial enough in both ourselves and our practices that we decided it was time to share it with other people, and Delta Veterinary Consulting was conceived. So we both truly believe that resilience training and tools, the lack of that we have available to us, or the knowledge in our industry, is a substantial problem. It is critical to have these tools, and it affects the amazing people that work in vet med. Our goal is to provide education and tools to help everybody from receptionists to doctors, because receptionists are just as important as doctors, to be able to handle the trials of veterinary medicine in a way that they can have a happy, safe, rewarding career, because that is what it should be. It's not an easy job. It's always going to have stressors, but we should be able to handle those things in a way that don't take a toll on us personally. So our long-term hope is that the individuals that find benefit in these things start to have a career satisfaction that they actually deserve, and it helps to improve the morale of the industry, as well as some problems such as staffing, patient care, and passion for the field being reignited for people. If you folks have any questions, please hold them to the end of the session and we will address them at that time. A quick note about who we are not. We are not medical professionals. Make that big letters. We're not medical professionals. The information provided in this course is just informational. It is not intended to replace advice or treatment of a licensed medical professional. Just take this information and do what you will. And I also want to let you know that we're going to be talking about some sensitive topics today, so please be mindful of that.
As Meg said, yes, we are talking about some sensitive topics. Through my research, I wanted to know kind of the state of the industry as far as its mental health. And one of the largest AVMA studies conducted from 1979 to 2015 uncovered that veterinarians die of suicide at a rate of 2.1 times the general population. The number of suicides increased at a higher rate over the years from 2005 to 2015. And I personally think that it has to do with the rise of the internet and social media, as that was not a stressor that veterinarians or other veterinary professionals had to deal with prior to that. So that very concerning statistic. In other regional data cited in the AVMA article found that veterinarians reported a higher rate of anxiety, depression, compassion fatigue compared to the general population, which I feel like if you've worked in the field, that's kind of, you can tell based on what we do every day, that would kind of occur. They think the contributing factors included high levels of occupational stress, long work hours, client expectations, unexpected outcomes, communicating bad news, high workloads, and professional isolation, which these are all things we're going to discuss later in the slideshow as well. Much of the research I found follows veterinarians, but not necessarily all employees. I believe that all of these stressors affect all veterinary professionals in some way or another, and we will talk about everyone in the hospital, not just the veterinarians. So another study that I found was conducted at an Australian veterinary school where they followed veterinary students in clinical practice. They surveyed them to see what their level of resilience was by using the brief measures of resilience scale, the 5 facets of mindfulness, and the NEF self-compassion scale. They found that only 6% of surveyed students had high levels of resilience, and 34% of those students had low resilience, which that's concerning. Only 6% of these students are coming to our clinics with high resilience, and we all know that the field is very stressful, so that's very concerning. But they did find that those who did have high levels of resilience had high levels of self-compassion, non-judgmental mindfulness, and non-reactivity mindfulness scores. So researchers in this study believe that additional research needs to be done in this area for veterinary medicines to hopefully increase the number of students that come out with high resilience. So now I'm going to talk about a couple of challenges I see in the industry, and I'm sure you've experienced being veterinary professionals. As a manager, I feel like staffing, especially since COVID, has been a huge stressor and challenge for us. We're looking at 1 in 4 individuals leaving the field completely and not coming back. We're posting 10 jobs and only having 1 applicant for that job, and then just finding credentialed individuals in general. Work-life balance, I think, has also become a really hard thing to mind, just because we are working longer hours because we have less staff. We have less veterinarians shouldering the burden of a lot of this, of the clients that we have. And then on top of that, like I discussed earlier, cyberbullying has become an issue with the advent of social media. And I think during COVID, when we were all locked up inside, that was the way people let out their rage, anxiety, stress on unintended targets or maybe intended targets, which sometimes are us as veterinary professionals. How do you see these challenges present themselves in your practice? Have that as an answer later when we do question and answer. So there are also in-clinic departmental challenges that are different in each department, but they all kind of are intertwined in some way. Veterinarians right now, as well as before, have issues with ethical dilemmas that they face every day, with clients not being able to treat treatable illnesses, euthanizing pets that could have been treated but the client can't afford, dealing with a high level of communication with clients. I think that's gotten worse with COVID and after COVID, just because we were having to do curbside and all of that, and there's just a higher volume of clients per doctor nowadays. And as baby boomers retire, there are less mentors for younger veterinarians coming into the field. I've noticed this in my own just observance in my own life. And that can be isolating, and it can cause some emotional distress for veterinarians in the field that are just trying to learn and become good professionals. As manager, I definitely find recruitment being one of the biggest struggles that I'm facing on a daily basis. But also with that, keeping and creating a culture in supporting team members. So bringing in a new recruit that supports a positive work environment, being able to help manage my own employees' emotional well-being is also a struggle. And sometimes it comes before my own emotional well-being. I also find that the rising cost of goods has really impacted our ability to care for our clients who can't afford the prices that we have to charge in order to pay our staff. And then veterinary technicians, there's very few of them left, and they're having to train non-credentialed staff members to do work while they're still handling the caseload that they are typically covering. And then they're also helping doctors with communications that because there aren't enough doctors to do that as well. And so they're just wearing a lot of hats, and that's causing a lot of stress. And then our poor CSRs, they're dealing with disgruntled clients from start to finish, whether that's them calling to get in, we don't have an appointment, they're upset because something costs too much, they're having those tough financial conversations about treatment, and then just managing the appointment schedule. They're dealing with veterinarians that are upset with them because their schedule is overbooked, and you have clients that are yelling at them because they want to get in. So all of these things affect the stress level and well-being of staff at a clinic. But there is hope, and there's good news. The AVMA did a study that looked at interventions to help veterinary staff avoid burden transfer, which burden transfer refers to taking on the pain and stress of another person. And in this case, that's the client. In this study, they basically had these veterinary professionals either do an in-person, like live webinar study, or they did a self-paced program. And in those it was the exact same material, and they learned ways to avoid burden transfer. And what they found is once they tested these individuals after the participating in the assessment, they were able to see that there was a reduction in burden transfer, and participants said that they used those skills further out beyond the actual program that they were in. So that's really good news that we can help ourselves become a better adjusted individuals in the field.
Now let's take a minute to talk about what resilience actually means. If we're going to be boring and look at the dictionary, it says the capacity to withstand or recover quickly from difficulties. Toughness. Here's some examples: the remarkable resilience of so many institutions supporting individuals to overcome adversity and build resilience. Our business has shown strong resilience during these unprecedented times. I really like the second description, and we're going to put it in a different context by imagining it in more of a physical shape. The ability of a substance or object to spring back into shape. Elasticity. For example, nylon is excellent in wearability and resilience. So while that first definition does give you a concept from a more emotional mental state, the description of the physical state really does allow us to put a nice visual to it. So let's put it in the simplest form. Picture yourself as a stress ball, just a regular old squeezy stress ball. You squish it, you let go, it goes back into shape. So let's be your stress ball throughout your day at work. You get to work, somebody calls out sick, but somebody else is already on vacation. So now you're just not short-staffed, you're really short-staffed, but all right, it's the beginning of the day, let's just get going. You get through the morning, it's time for lunch. Just kidding, because a hit by a car just walked right through your doors, and you have no choice to treat that. None of us would turn that away. So while everybody does their best, it doesn't work out well. The patient has to be euthanized, and you are trying to console the family as you're trying to collect payment, which is awkward but necessary. We know that we all have to do that. So after lunch, everything's going right. Just kidding, Mrs. Jones is coming in to pick up the insulin that you told her that was there, and it's not there. How is that even possible? But it happens. Now it's time to unload the food truck. Half the order is missing. So now you can call the clients that ordered their food and tell them that it's not going to be there. A little bit later on during the day, a colleague's school calls and says her kid is sick. She's got to go get her sick kid. So now you're super short-staffed. You're going to stay late tonight. At the end of the day, you get home, you kick off your shoes, you're ready to relax, and you realize that you never even turned on the crock pot and you have no dinner. It happens. How's that stress ball looking? After it has compressed with every little thing, have you allowed it to spring back at all? Or is it a flat smushed ball at the moment? Here's a thought to think about. Was anything in this day truly abnormal, or does this seem like an average day for you? Nothing really bad happened. Yes, you don't have a hit by car coming through the door every day unless you're at an emergency clinic or in your really high population area, but none of those things were actually really significant out of the norm things. Yet you still might be really squished at the end of the day because of the compression of all of these stressors happening throughout the day. How much worse would that stress ball look if there was a really serious event on top of it? How about a patient dies under anesthesia? That kind of thing does periodically happen, and that is devastating to not just the staff that was involved in that situation, it's devastating to everybody, and it affects everybody from the reception that has to receive that patient, that owner coming in to talk to the doctor that has to tell it, to the staff that has to deal with the client. It affects everybody. What's a stress ball look like now if you add something like that in there? If the daily compressors already squished you down, something additional, it could be a lot for you. So how we're going to handle these little situations, that's up to us. We can continue to compress all day long and leave work and get home as a squished ball, or we can become resilient and we can teach ourselves to spring back into shape so that we are not so stressed and we are not so crushed by the regular things that come our way. That way we're able to handle the even harder things that tend to happen from time to time, like a patient death under anesthesia. Springing back into our original shape, that is what resilience is. Now, to be very clear, it doesn't mean that we're not impacted by these things, and it doesn't mean that we're not empathetic. We just don't shove those things down somewhere inside us and never deal with it. What it means is that we can experience these situations and be less impacted and quickly learn to recover and move past it, because these things are going to happen to us. It does not make you a dead soul that has absolutely no impact by these things. It teaches you to move on from them, experience them, process it, and move on. So in a little bit, we're going to talk about 2 tools and techniques that you can help to process these moments without hanging on to them. There are many tools and techniques, but today we're going to cover just 2. So a side note, in fact, it's actually really good when stressful and difficult situations happen, because those are practice events that can make us stronger and much more confident in ourselves. Let's talk about resilience and self-care. They're both very important, but they are not the same thing. These terms tend to get interchanged, but they're really not. So if you think of resilience as the armor on your body protecting you, self-care is the polishing and the maintenance of that armor to keep it strong. So the Oxford definition of self-care is the practice of taking action to preserve, improve one's health, usually initiated and carried out by the individual themselves without professional consultation. This means it's something that you yourself are choosing to do. It is not something prescribed to you by a doctor, or maybe in some cases it probably could be. So we all know examples of self-care. Some things for people might be massage, taking a bath, seeing friends. It could really be anything as long as it's impactful to you as an individual. Something to consider is that your resilience is never going to be 100% every single day. Life is going to happen. You're going to have these events where big stressors come in, and your resilience and stress levels are going to shift. The important thing is that you are doing what you can be to maintain them. According to the Mayo Clinic, the correlation between stress and resilience is particularly concerning. Resilience not only offsets the traumatic experiences affecting one's mental health, but also enables people with existing mental health conditions to cope better. That's really important. The practice of consistent self-care, that is what happens to keep stress levels down. Like I said, you're going to have stress levels. You have to learn to maintain them by using self-care. That is what keeps your resilience up. Again, that can mean anything as long as it is impactful to you. Maybe it's taking a bath. Maybe it's getting a massage. Maybe it's making sure you walk 2 miles a day. It could be anything as long as it is impactful to you. A specific note for veterinary individuals, specifically managers, is to make sure that you're not neglecting that self-care. I can tell you that myself as a manager, I am very good at telling other people they should practice self-care, and I have not been very good at making sure that I do it for myself. This is why I now schedule my self-care into my schedule. I hired a personal trainer. I have to see that personal trainer or she'll yell at me, but it is on my schedule. I can't cancel it. I can't go around it. It's there. it gets done. If I don't put it in my schedule, it's not going to happen because the busy practice, the busy life, the family, it's all going to override it. And by the time I know it, I've already missed self resilience or self care for the entire week. So put it in your schedule and allot that time for you.
Sorry. So, two tools we're going to talk about today as ways of improving our resilience are self-compassion and reframing. So, reframing is a technique used to reframe a problem or situation by viewing it from a different perspective. Self-compassion is being kind and understanding towards ourselves when we suffer, fail, or feel inadequate, rather than ignoring our pain or self-punishment with criticism. So, I'm going to walk you through a couple of scenarios in which we can use reframing, or we can see what the situation looks like without the reframe. So in this situation, a new lead CSR is tasked with training a new CSR. This lead takes great pride in caring for her clients and going the extra mile to make sure that they are well taken care of. The lead witnesses the new CSR being overtly rude and dismissive to the client. She quickly corrects the CSR and apologizes to the client, but internally she has many feelings. She feels ashamed by the new CSR's behavior. She feels like she failed in training her properly if she thinks that it's okay to act that way. She feels like she must be the worst lead CSR if she can't even train an employee to be nice. So the reframe for this situation is the lead receptionist takes a moment alone with her thoughts and recognizes she is mad and embarrassed by the CSR's behavior, but she never trained or condoned the CSRs to act that way. She knows she needs to talk with the CSR to figure out why the CSR wasn't aware of how she was coming across, so they can do additional coaching. The lead realizes she is a new lead and she isn't going to be perfect, and she needs to take this experience as a lesson for the future. So instead of internalizing it, she's looking at it as a lesson that she can use in the future. So the first thought pattern, like I said, she internalized and blamed herself. And the second, she learned that she can't take ownership of somebody else's actions. She can just do what she has power in her job. So that means coaching, directing, potentially escalating it to a manager if this behavior doesn't improve with this new employee. So in conclusion, if she had continued in the same negative thought pattern where she internalized, she's going to have a lot more stress long term by hanging on to that than if she just uses it as a lesson for the future. And now we're going to use self-compassion. So the way I think about self-compassion, it's the way I would talk to myself internally as if I were a friend talking to a friend. So in this scenario, a new veterinarian has a patient that comes in with symptoms of pancreatitis, and the owner's history corroborates these suspicions. The owner declines all diagnostics, and the veterinarian treats symptomatically because that's all they can do. Days later, the vet receives a report from the emergency clinic indicating the patient has terminal cancer. The owner writes a terrible review about the veterinarian online, claiming they didn't do their job. The veterinarian is devastated because they did not catch this, even though the client declined all diagnostics. They are embarrassed that their online reputation is tarnished, and ultimately they feel shame for feeling like they failed a patient. This is a great deal of emotional turmoil for a new veterinarian, and I'm sure we've all experienced something like this in our own practice. So how would that veterinarian speak to their best friend in the same situation? If a friend of the veterinarian came to them with the same experience, they would tell the friend that they couldn't properly diagnose the patient with the owner not consenting to any diagnostics. The veterinarian would tell their friend not to take ownership of the stress and anger and negative feelings the client has because they have no control over those. If the veterinarian has the same dialogue with themselves and treating themselves with kindness and compassion, the weight of this negative experience is much less than if they had placed all the blame of the negative outcomes on themselves, which I think is something that as all professionals we can learn, but especially our veterinarians, they deal with this kind of ethical dilemma all the time, and it definitely weighs on them. So I have an example of self-compassion in my own life recently. So I was out of the country on vacation, and I received a text from one of my employees telling me about how awful of a day they had. They had 8 euthanasias in one day, which for us is a lot. Um, and they were all long-term patients that we've known since they were puppies or kitties. And she was telling me about how they had to stay almost 2 hours late past close, and that lots of the staff were crying as they left for the day. And as someone that's thousands of miles away, I was feeling very hopeless, and I felt like I had failed my employees by like not properly staffing them. And even though I couldn't have foreseen this coming, I felt like a responsibility to make everything better, even though I couldn't do that necessarily from far away, or even if I were there. And so, in order to like not ruin my entire vacation, I kind of thought back, the only thing that I can do in this moment is listen to my staff member and be a listening ear for her, and that I can't take accountability for things that I couldn't foresee, like 8 euthanasias in a day. And being able to do that did help me be able to enjoy the rest of my vacation instead of hanging on to that emotional stress and worrying about it for the rest of the time.
So I'm going to give you an example of reframing from my experience. Several months ago, I had to intervene in an exam room where a client brought in a urine sample that was well past the deadline to make it part of a lab panel, so there was going to be a cost associated with that. When she complained about it, the assistant in the room said, I'm really sorry, but it is on the label. The deadline is on the label. It is on your receipt. There's a paragraph on the paper that we gave you, and we verbally told you. Unfortunately, there's really not much further we can do. So the client became hostile and called her a scumbag. She stepped out and got me. I went into the exam room and I said, you really can't be calling people scumbag. We do not tolerate name calling or abuse here. This person sort of escalated in a way that was above and beyond the situation. She did have some mental health concerns that became evident during that conversation. And I have dealt with many, many hostile individuals over the years. It's something we don't tolerate at our practice, but throughout my entire career of nearly 26 years, I have seen it many times, especially working in emergency. So I ended up speaking with this owner. I had to ask her to leave. This kind of thing in my general practice very rarely happens. But from time to time, stuff like this is going to happen. So she left. Not a big deal. Everything was fine. She continued to call my practice. So she called the first time and spoke with my senior receptionist and just, made some comments and complaining about me. And my receptionist was a little upset about it, said that's not true, hung up on her. I do allow my staff to hang up on people that are being hostile with a warning. The second time she called back, she told my receptionist that she hopes that my children die. So that's an awful thing to say to anybody. And my receptionist came to me and said, she called again and she said something, but I don't want to tell you what she said. Well, now I really need to know what she said. So when she told me that, I can tell my receptionist was very upset. And I had two ways I could handle this situation. I could panic. I could think that this person was going to make an attempt to harm my family. I could be really hurt by that. I could be very upset. I could spiral down a very unhealthy path with this, or I can reframe it and I can say, you know what? This is an individual that has some mental health problems. She's making an attempt to wound me and wound the practice, and I'm just not going to give that person that power to have that effect on me and let it go. My poor receptionist was more upset than I was, and I had to tell her to let it go. It's okay. Sometimes people make an attempt to wound you. I want to say that my practice owner, who I currently work for, told me many years ago, why would you give somebody the power to hurt you by accepting what they threw your way? And she was right. And what that really is reframing. So by reframing that, I was able to completely move on from this situation, undevastated, unbothered, and I just continued my job. The other thing is that because I responded that way, my staff was able to also sort of move on from that situation. So, summarizing today, this is a brief look into our importance of resilience and how we think it impacts the industry. We talked about what resilience is. Try to think of it in that ability to spring back into your original shape after the events of life and practice compress you. And we talked about resilience being the armor on your body to protect you, and self-care being the polish, and how important both of those things are to allow you to maintain that shape, or at least push back into it when things get tough for you, because those are things that are going to happen every single day in our practice, and there is no changing it. Yes, you can do things like not tolerate abusive situations in your practice, but it doesn't mean that you can take away events that already happened to somebody. You can fire that client, but the event already happened, and you don't take that experience away from somebody. You teach them resilience so that they can get on the other side of it. So resilience is truly a critical component of maintaining healthy stress levels and cultivating a happy and rewarding career, because that is what veterinary medicine should be. It is a hard job. We have hard jobs, everybody from receptionist to doctor, but it's a wonderful job. And if we can maintain our healthy resilience so that we are in a position where we are always able to overcome the challenges that come our way, whether it's the daily stressors or something really hard on top of it, then we can truly enjoy this profession for what it is.
And I discussed a lot of hopeless sounding statistics within the field. And I feel like we also discovered that through some of these studies, we can change, and we're not doomed to just be depressed, anxious, and stressed out all the time. And I think that the other tools that we discussed here today are great ways for you to be able to enjoy your life again at work, especially post-COVID. And we hope that we can share more tools with you in the future.
Thank you so much. We hope that you found at least something that was beneficial to you today. As we are progressing forward into 2025, Lindsay and I will be releasing a course under Delta Veterinary Consulting that will go into many more tools and techniques and take a deep dive into the neuroplasticity field that explains how you are able to reprogram your brain and your response. Because as we discussed, you cannot control anybody else's behavior or situations. You can only control your own. And that means controlling your reaction to things. So please keep an eye out for our full course coming in 2025, and also feel free to reach out to us at delta.veterinary.consulting@gmail.com.
Awesome. Thank you, guys. I have a question for Lindsay.
Yes.
On your statistics, and I know you might not have this because the veterinarians get the focus a lot, which is, it's okay. Yeah. Our field is about them and what they do. Do we have any statistics on the suicide rate for other team members outside of just the veterinarian?
I couldn't find any suicide statistics, but I did read an article, and I think it was also an AVMA study done, or no, it was Merck, that looked at the burnout rate in all the different positions within a hospital. And the receptionist had a much higher burnout rate than even the veterinarians did. And the managers were tied with them for worst burnout rate. But there weren't any actual suicide statistics that I could find.
I think, and it might be hard to quantify that because of all the differences in the positions and all of that.
Yeah.
And I had another question. Now I forgot. Those are great information. I like the reframing. That's a great way to kind of like, okay, stop, reposition yourself or whatever. And I like the reframing concept and trying to do that. And I think if you can teach your team members that, I think Meg's comments about how she decided to not take offense to what that lady said, like it would 100% make a huge difference on your team. Because if she had kept going on about it, not that she had a right to, but if she had done that, then the whole team would have been up in arms about it. I 100% am like happy that you were able to reframe that and not have that, carry it on you. So that was great, Meg. I'm happy that, I'm sorry that lady obviously said that. Sure.
It's all right. It's all right. It doesn't bother me, but you do have to teach the staff to do that. And you have to, when you teach the staff to reframe, you have to tell them first what it is. It's a good idea to do, brief resilience meeting, mention it at your staff meeting. And then when these situations come up, verbally explain to them, all right, we are going to look at this in this different way. You don't have to, you're not going to have to do it forever, but help them start to develop that skill by saying, all right, you know what, guys, we could look at it this way, or we could go down this path. Which way is it going to make a difference in the situation? Probably neither. But which way is going to make a difference in the situation on how it impacts us as individuals? And eventually you expose them to that so many times, they will then be able to hopefully do it on their own. And then, like anything else with neuroplasticity, you can treat your brain to make it a habit.
You can make the habit. Like that one thing that I've heard, and I think they use 7, but I use 9. Is it going to matter in 9 seconds, 9 minutes, 9 days, 9 months, 9 years? Like that whole thing. Like you stub your toe, is it going to matter 9 seconds? Maybe, but probably not 9 minutes, right? So I love that concept. But I do have a question for you that Christina's asked. And it says, how can you help an employee who tends to be defensive during coaching? This particular employee is often also combative with clients. So what
An
would you
employee
recommend?
that's going to be defensive during coaching, that being defensive is a choice. That's a performance choice. You can consider addressing directly with that. I would point blank ask this person every time I make a recommendation for you, you are becoming defensive about it. Why is this happening? I don't know what kind of response you'll get, but I look at this sort of as a less resilience kind of thing, and this employee is making a choice to not change or to not take the tools that you are giving them, especially if they're becoming combative with clients. That's also either a choice or they have perhaps some mental thing that might need to be addressed through an ADA talk. I would point blank ask this person why they're doing that, because they're not going to listen to you unless they choose to listen to you.
Yeah.
Very difficult to deal with. And I have dealt with that more than once in my career, and I have ended up in more than one scenario having to let that person go because they refused to change. You can change, but you have to make it a choice.
Yeah.
The reframing example is real, by the way, if that gives you any indication of the CSR. And yeah.
Yeah, I love it. Anyone else have any questions? That was the only question in the chat. All right. If there's any questions, feel free to unmute real quick. Otherwise, we'll go ahead and end or put it in the chat. I don't see anything coming up. Well, thank you all so much for everyone coming today and listening. I love this information. I'm excited for what your course will entail. You'll be also, there's another Josh. Oh my God. Josh in Colorado.
Oh,
Oh my gosh. He does a ton of resilient stuff. And Josh is going to hate me right now because I know him personally. We're friends. This is great when you have a brain fart.
I'm right there with
Online,
you.
everyone's looking at you. Anyway, so Josh, a good friend of mine that I can't remember his last name, does a ton of resilient stuff. So I'm excited to see another company doing it as well, because I think it's such a good topic and it's something that's not easy for everybody to recognize. And I think it's good to have like little tools to help you get better at it. So I'm really, really excited to see what that looks like for you. So, all right, wonderful. Thank you so much. I'm going to go ahead and stop the